everyone. I hope you're having a great week. I just want to review a few things for Chapter 7 this week. The first thing is that Chapter 7 talks about is, one of the things it talks about is Fowler's theory of faith development. And so this is something that you're going to be learning a lot more about from one of the theory showcase groups. So write down any questions that you might have, maybe ask them in their group presentation. But basically, kind of a quick overview is the understanding is that spirituality is an important aspect of human diversity, and it shapes major dimensions of many people's lives and can provide a significant source of strength. And it can also provide a lot of empowerment for social workers to address. So we look to a client's potential faith development as a source of strength or a place for potential growth in that area. Some other things that this textbook, this chapter this week talks about is suicide in adolescence. And your discussion board post specifically talks about some of this as well. So suicide in adolescence specifically can be very critical in adolescent years. Obviously, it can occur at any point in someone's life. And far more adolescents think about committing suicide or make an unsuccessful attempt than those who actually succeed. So there's several different causes, leading causes for adolescent suicide. And that is LGBTQ youth who struggle with coping with stressors of their life. There's also several suicidal symptoms that the textbook talks about. It should be emphasized that any of the available guidelines to assess suicide are just that, they're guidelines. People who threaten to commit suicide should always be believed. So the textbook goes over a little bit more about something called the SAD person's scale. So what that is if you look at the acronym SAD persons, S stands for the sex. And so 1 if it's a male, or 0 if it's a female, because more females attempt suicide, but more males succeed. Age, if they are less than 20 or over 44, you give them a 1 point. D stands for depression. And so you give them 1 point if depression is present, 0 points if it is not. P stands for a previous attempt, 1 point if previous attempt was made, 0 points if no attempt was made. E stands for excessive substance abuse. So 1 point if it is present, again, 0 if it is not present. Rational thinking loss. So you give them a point if they lack rational thought. S stands for social supports. So 1, you give them a point if they are lacking social supports. O is organized plan. 1 if they made a plan and it is lethal. N is no spouse. So you give them a point if they are divorced, widowed, separated, or single. And then S is for sickness. 1 if there's a chronic or debilitating or severe sickness. Now I imagine for adolescents, especially the N for no spouse, obviously many adolescents are not going to have a spouse. And so you might change this to like recent breakup from a partner. So there's a couple of different things that you do when working with a potentially suicidal person. The first is going to involve addressing the immediate crisis. And then the second level would be to work through some of the other issues that caused or exacerbated his or her stress. And then the textbook also talks a little bit about suicide prevention and crisis intervention and potential resources that may or may not be available in an area, different programs and services as well. So that's just an overview of the information for this week. As always, if you have any questions, don't hesitate to ask. Thanks so much.